So I like Albert Einstein. You know, there's a lot of great things, obviously, that he's done in physics that are way over my head. But some of the other things he said are very good. If this looks normal to anybody right now, then you probably did have too much to drink last night. But I put this here for a reason. And I think it's something that we need to, I don't think that anybody in this room has this idea, but a lot of our colleagues and sometimes even our physician friends forget that the mouth is actually really attached to the rest of the body. You know, when I'm going to talk about heart rate variability, physiologic parameters, there's a lot of material. When I learned about heart rate variability, it's been years of stuff. I'm going to try to condense everything down into an hour or so. I'm going to try to show you how I did a search for objective evidence on the things that I'm doing, how I make clinical choices with the equipment that I use, look at the autonomic functions that we're actually testing, look at heart rate variability. I'm going to show you literature. There's a lot of literature out there. I use PubMed, which is the Library of Congress for journals in the United States. When you type in heart rate variability, there are over 12,000 articles on that. The articles for dentistry are a lot smaller with heart rate variability, but they are picking up. So in looking at a system of heart rate variability, what we have is I have a monitoring assessment system for the dentist and other practitioners. And then when I say other practitioners, I mean the people that we work with, physical therapists, physicians, acupuncturists, craniosacral, anybody out there who we work with. I do an initial assessment on my patients where we basically hook people up, we get a baseline study, and I know where I can go from there. I can design my treatment where basically I do a lot with wax bites. I know everybody has a different way of doing it, but for me, I warm up the wax, I have the people hooked up, and I can see what position I want to be in, and that gives me a start point. If you've ever done anything with a wax bite, people sometimes ask me to take the wax bite home with me. So I give it to them just to, you know, they come back with this little thing that's all melted up at the end anyway. We can monitor our adjustments, so we get the appliances in, we do adjustments, and we look at what's happening. And then we have an objective assessment, because now I have raw data, I have EKGs, I have EMGs, I have all different parameters, and I can see a change from here to here. It may be really good, it may be bad, but at least it helps guide me into what my next decisions are going to be. So basically, these are a couple of the screens that I work with that run concurrently. Can I answer the question at the end? Is that right? Or you?
Just what's the lower appliance in this case?
It was just like a modified Gel appliance. Okay. So these are the screens that I work with here. What we're looking at here is there are 5 screens that run concurrently, so the data is there. When we go back, we can always run the data through any one of the screens. But we have respiration rate, I have EMGs, I have a frequency analysis of heart rate variability, an EKG heart rate. I have the interbeat interval, which is what determines heart rate variability. I have respiration rate versus heart rate over here, frequency analysis, and then basically the analog numbers. Another screen that I have allows me to have a webcam. Dr. Liem talked about that yesterday, having the evidence of the patient. So I have the patient actually sitting here with the appliance in their mouth. We have an EMG screen, which you can see the numbers are firing. Even though it looks like it's balanced, it's higher on the right side, and this was an issue for the patient later on. And then this last screen is actually a biofeedback training screen that I use with the patients. You'll see that there's this ball that goes up and down, and that's actually a pacer for breathing. And as the patient gets into their target range of breathing, there's a biplane that you'll see that's flying around. She's actually controlling that plane with her breathing. So it gives the patient something to do while they're there. And I know Dr. Liem talked about biofeedback briefly yesterday, but there's a lot of evidence in the literature that shows that appliances work well, biofeedback works well, but biofeedback and appliances work really well together. So what are we talking about when we're talking about all these different physiologic parameters? We're talking about central mediation. We're talking about the autonomic nervous system and how it functions in our body. We're talking about the sympathetic nervous system. We're talking about the parasympathetic nervous system. The sympathetic we're going to get into is fight or flight. The parasympathetic is rest and digest. There's also the enteric, which a lot of us don't really talk about anymore, but it has to do with gustatory changes and GI. You know, the old model that I know I was taught was that sympathetic is over here, parasympathetic is over here, and it's either one or the other working. It's not the two working together. Really what happens is they work together. The sympathetic kicks in, the parasympathetic is supposed to take over, and the sympathetic is supposed to drop off. In our pain patients, what happens is sympathetic kicks in, and what happens is we never get the vagus to basically break us over into parasympathetic.